Meanwhile, it just so happened with the SCOTUS news, no news today. This morning in Boise, U.S. Department of Health and Human Services Secretary Xavier Becerra sat in on a forum about Idaho's abortion laws. On the panel with him, impacted Idahoans and doctors. Idaho just a stop on the National Reproductive Health for All tour, a tour from the Biden administration to discuss expanding and protecting abortion rights across the country. So I guess right place, right time. Joe Parrish, you were there this morning, so you got a chance to ask him about this premature post?
Yeah, I did, and you can kind of imagine what he had to say, but it is interesting. We'll get to that in just a moment. As the event was getting started in the Linen District here in Boise this morning, we were starting to get a fuller picture of what happened with SCOTUS and that premature posting. The event itself that we were attending was including local doctors discussing the challenges of Idaho's abortion laws, and we also heard from Jelaine St. Michel, who appeared on the 208 last week. She shared her story about being forced to go to Seattle, Washington from Idaho because she needed an emergency abortion. The pending Supreme Court decision will be official this week, tomorrow or Friday. For now, though, I asked HHS Secretary Becerra about the premature opinion post and his thoughts. He said it's important to wait and not speculate, but he did add this.
Anyone in America who is at risk of dying or losing their health status and needs to go to an emergency room should be able to go to an emergency room. That's always been our position. Whether the care that a medical professional says you need to stabilize your health or to save your life is an abortion or not, bottom line is none of us wants to be denied access to an emergency room when we need it. If indeed the Supreme Court upholds the very practice principle that you are entitled to get the emergency care that you need based on what your medical professional, that doctor says you need, that would be a good thing.
On the panel of doctors also sat Dr. Lauren Colson, a family physician and member of the Idaho Coalition for Safe Health Care. I asked him if the Supreme Court does go with the supposed opinion that we've heard. If that does happen, how does it impact the reality of Idaho?
And honestly, in Idaho, with our laws, not a whole lot changes. And this teeny tiny little carve out allows us as physicians in very specific scenarios to provide the care and hopefully not life flight people out of the state so they have to go somewhere else to get the care that we could easily provide here, but it does not fix our problem here. We still have a huge problem when it comes to being able to access an abortion when you need one.
And if you want to hear more from the panel, I would recommend checking out the 3-part series from the 208 team that aired last week. It was just a matter of happenstance and coincidence, but some of the people we heard from last week in those 208 specials, they were a part of this HHS panel, and we heard the stories that they told us on the 208. Very powerful stories, and it gives the context of what's going on outside of just the written law itself. How has this been playing in? Whether you agree with it or not, it is definitely worth checking out.
And what they said to us last week was they would like to see that change from life of the mother in Idaho's law to health of the mother. Those who pass the law say that is a term that is too broad.
And it's going to be interesting to find out exactly what happens officially from SCOTUS. But as you heard Dr. Colson say, even if it is the case, it is a very narrow carve out here in the state of Idaho.
All right. Thank you very much, Joe. We'll keep tabs on that. Wait to see what happens tomorrow.